Hello everybody, I am here Mrs. Brammu, Assistant Professor from SNS College of Nursing to share on a subtopic of cardiac assessment which is jugular venous pressure assessment. So yes, in this session we will be skimming and scamming through what and how a JVP assessment to be done and what are the special considerations and how we will be doing the interpretation. So coming to the first slide, that is, what is jugular venous pressure assessment? Actually, it is visualizing, or otherwise we can call it as the observation of pulsations at the neck region, especially the jugular veins, typically on the right side to estimate the pressure of the right atrium by measuring the vertical distance between the visible pulsation and the sternal angle. As you can see through this picture that the healthcare worker is having a small sort of device over here where you can see the device of one end is being placed on the sternal angle and the other end is placed very close to the jugular vein. So yes, we will be seeing in detail in the further slides. So let's have a quick workup on its anatomy, that the jugular venous pressure, where it is located and how you are going to see it. So when you go through this picture, you can have an idea on how the sternal angle is, and just very close to the sternal angle is the head of the sternal angle where it starts, and then you can see to the topmost level is the internal jugular vein, and at the from the clavicular level, how you can draw an imaginary line from the sternal head and the clavicular line, and it is mostly located in between these points is your jugular vein. So here, to assess the jugular venous pressure, the patient will be placed at 45-degree angle, located between the two heads of the sternocleidomastoid. And you can see in case of heart failure, especially right-sided heart failure, this jugular venous pressure is being increased. So what does this jugular venous pressure data predict? So here it gives us an insight on how the patient's blood volume is. It also shows us the potential signs of heart failure in case if the jugular venous pressure is mostly elevated. And this also reflects the pressure of the right atrium, which is nothing but the central venous pressure. So in which conditions this JVP can be elevated? In cases such as thrombosis of any arteries or veins, and if there is any obstruction in the superior vena cava, in case of cardiac failure such as right or left heart failure, most predominantly on right heart failures, and in case of valvular problems such as tricuspid regurgitation or tricuspid stenosis, and in certain cases of COPD, or in cases where there is elevated fluid inside the intravascular layer caused by ascites, or might be it is due to pregnancy where there is hemodilution, or in cases of a pleural effusion such as a lung disorder. On the opposite hand, you can see that the jugular venous pressure may fall in case of reduced volume, that is hypovolemia, and which can contribute to develop shock, and in certain diseases such as Addison's disease. So this is how the JVP may be elevated in some of the following conditions such as thrombosis, COPD, ascites, and so on, and the JVP may be reduced in cases of hypovolemia, shock, and Addison's disease. Now, how do we perform this jugular venous pressure? Always, the first and foremost, as a nurse, we have to think on how we are going to place the patient, on what position we are going to make him or her to lie down. So as this is mostly dealt with the veins of the neck, so it is better to make the patient to lie on semi-reclined position with head slightly elevated at an angle of 30 to 45 degree from the thorax. Then, as an examiner, we need to locate the internal jugular vein, which is always easily from the lateral border of the sternocleidomastoid muscle. Just you're going to have a triangle of this one. So here between this triangle, you have the internal jugular vein. Then initially observe the pulsation of the vein and identify the highest point of visible distension. Use a ruler to measure the vertical distance from this point to the sternal angle. This we call it as the reference point of the level of right atrium. So how do we interpret this condition? Yes, it is very simple that the normal jugular venous pressure is considered to be between 6 to 8 centimeters of water. In case of elevation such as right heart failure, fluid volume overload which is hypervolemia, any tricuspid valve diseases, or in case of SVC obstruction, there will be elevated JVP. And in certain cases where the JVP may go to the lowest point such as hypovolemia, shock, or in case of Addison's disease. So here you can see in this picture, that is how it is going from the sternal angle 3 centimeters, from the mid-atrium 5 centimeters, and you can also cross check with the PQRS complexes and the venous pressure waves. So the following points to be kept into consideration, such as how do we place the patient in position. So it's very essential that you place the patient in the right prompt position to get reliable value, and the waveforms of the JVP can be easily identifying us whether they are on the borderline of LV dysfunction or whether they are in the case of hypovolemia or hypervolemia. And when it compares to clinical context, the jugular venous pressure assessment should be interpreted within the context of the patient's overall clinical presentation as well as the physical examination findings. On the left hand, you can witness like how they start with the jugular venous pressure. Padding beyond the scale is necessary so that it's not going to hurt the patient in case you drop the scale on the patient's body. And the thickness of the pen where you prompt the jugular vein, as well as other, that is in case of where the zero starts. All these 3 points will be contributing factor to find whether the jugular venous pressure is going to be the normal value to all. And that's all for today. Hope you all enjoy the video. And in case if you have any doubts or if you would like to have some suggestions for improvement, please do place on the comment box, and don't forget to share and like the video. Thank you for your patient listening. See you in the next video. Thank you.